Health authorities believe the variants could be behind a recent uptick in severe cases across the country. As Eric Sorensen reports, there is a concerning shift in who's at risk.
Almost 10% of Canadians have now received a first shot, but vaccines are playing catch-up. COVID variants are amplifying the pandemic. And another curveball? Younger adults are getting hit harder than expected. Ontario has seen a spate of cases as the variants spread.
Well, we are seeing that the variants of concern are striking more younger people. If the variants of concern increase exponentially, we're going to need to have medicine beds, we're going to need to have more intensive care beds, more ventilators, but we're ready for that.
Readiness includes a field hospital outside one health centre in Toronto if a third wave takes hold. Hospitalizations in Ontario rose dramatically in early January, fell just as rapidly until mid-February. Now the numbers have begun to climb. And the need for intensive care beds also peaked in January, then dropped off, but have risen again to more than 300 ICU beds now in use. And it's not just older patients who need them, says one ER physician.
That's really what we're feeling right now is patients in their 40s to 60s who are sick with COVID, whose oxygen saturations are low, who need to be admitted, and some of whom need to be admitted to the ICU.
One explanation for a growing number of serious cases among younger adults, older Canadians are increasingly protected by vaccines.
If you have less older people being susceptible because they're vaccinated, you have a larger proportion of healthy working people, younger people being exposed.
In any event, COVID variants are throwing a wrench into plans to normalize life in this country until vaccines in bigger numbers can come to the rescue.
The vaccine, I think, will contribute to decelerating the epidemic, but it's not going to do it yet.
The public health advice for now, social distance a while longer. And that includes saying no to big gatherings at Easter. Eric Sorensen, Global News, Toronto.